Welcome to Plastic Surgery Talk with Dr. Stephen Mulholland, brought to you by SpaMedica. Hello and welcome, Dr. Stephen Mulholland here in Toronto, Canada on Plastic Surgery Talk. Welcome to our latest installment of our podcast series. This podcast is on a brow lift, the modern approach to brow lift surgery. If you're interested in these podcasts, you find them interesting or entertaining, please subscribe, share, and comment. So what is a brow lift? A brow lift is a surgical repositioning of the eyebrows such that it provides a more aesthetically pleasing upper facial, upper lid brow unit. It can be subdivided into a full brow lift and repositioning, a tail of the brow repositioning, or even a central brow repositioning. So the modern approach to brow lift surgery has been limited access, subtle to focused repositioning of the droopy or the ptotic, as it's called, the ptotic meaning droopy elements of the brow, that gives a more pleasing look to the eyebrow contour and accentuates the upper lid appearance. So how are brow lifts performed? Well, it depends on the type of brow lift. Typical brow lift performed in a woman now is going to be a limited port incision. That means small access ports in the hair so it's hidden, no longer extending from ear to ear like when I trained in the 80s. The old bicoronal incisions typically aren't done anymore unless it's a very, very heavy browed, older patient, male or female. Typically it's going to be a limited access, small port access, undermining of the soft tissue envelope, and then repositioning and fixation with high-tech techniques such as tiny little fixation bioabsorbable screws or bioabsorbable constructs that hold the brow in place and then dissolve away, bioabsorbable suture suspension threads that hold the elevated brow up until the brow heals to itself, and then that focused elevation of the brow can be a long-term result. Who's a candidate for a brow lift procedure? Well, any patient, female or male, that has droopiness or heaviness of the brows, where the brow itself subtends or descends upon and over the orbital rim and leads to very excess folds of skin of the upper lid. It can be combined with or without an upper lid blepharoplasty or upper lid job. And typically we start with elevating the brows and then see how much lid skin or excess flesh remains, and then take away a little bit of the upper lid skin and tissue, and that's called an upper lid blepharoplasty. It's very common to perform those two in tandem. So a male or female candidate who are medically well, who don't have any ocular pathologies such as dry eye syndrome or lid closure abnormalities or inflammatory conditions of the eye or untreated, undiagnosed glaucoma or macular degeneration. Any of the common medical conditions of the eye need to be treated first. Most patients generally have to have reasonable expectations of what can be achieved. And typically they need to have hair to hide even the very small limited incisions like the 1 or 2 centimeter incision ports we now use. If a patient happens to be male and completely bald, we do have a brow lift that can be done through the upper lid incision called a trans-blepharoplasty brow lift. And the trans-blepharoplasty brow lift, or TBB, is a nice elegant way to elevate a very hooded tail of the brow on a male patient. So the best candidates have reasonable expectations, reviewed the informed consent document for risk and benefits, don't have any uncontrolled medical conditions, and are willing to undergo a procedure that requires a good week of recovery. Contraindications to a brow lift would be unrealistic expectations, uncontrolled medical conditions that negate the ability to do surgery, periocular eye issues that are unresolved, such as medical eye conditions, poor eye closure, dry eye syndrome. These are the common contraindications to surgery. Of course, a woman shouldn't be pregnant and should have no inflammatory conditions in the region of the surgery or undiagnosed lesions in the area of the surgery that haven't been managed. So what are the specific steps of a brow lift? Well, a typical brow lift for a male and a female is designed to selectively elevate the droopy elements of the brow. Typically, that will be the outer half or third called the tail of the brow. Elevating that tail of the brow elevates some of the droopy elements of the upper eyelid, and it can allow us to be a more limited incision, upper blepharoplasty. So we start with local anesthesia. Often brow lifts are performed under local anesthesia with some light oral sedation. The subcutaneous envelope of the skin is elevated off the bony aspects and the deep muscle of the brow, and that can be done in several manners and techniques. Bits of excess brow and the hairline can be excised, and then fixation and stabilization can be occurring through very, very small ports. I typically use barbed bioabsorbable sutures to support the brow while it's healing, then it heals to itself. And typically patients need to have their brow wrapped and protected for about 5 to 7 days. So typically about 1 week off work till they're back into makeup. And again, it's very, very common to combine a brow lift in a male and a female with an upper lid blepharoplasty. So we elevate the brow to increase the distance between the eyebrow and the eyelashes, and then remove the unwanted extra flesh that exists between the eyebrow and eyelash, and that's called the blepharoplasty. What's the recovery from a typical minimal access modern brow lift? Typically about 7 days. There's a little bit of swelling and bruising in the eye area, but typically that resolved very quickly. It's not very painful because of limited access ports and undermining. There's no numbness in the scalp, no prolonged sensitivity to the scars. Typically there's very little, if any, hair loss or telogenal effluvium or shock hair around the elevation. And patients can look quite good in makeup at 1 week. It takes up to 6 weeks for stabilization and elevation to heal, and about 3 months for the bioabsorbable fixation systems, the tiny little endotines or the bioabsorbable sutures to go away, and the brow is held together by its own inherent autogenous lifting and wound healing capabilities. Patients describe the postoperative pain as modest. Let's say aesthetic surgery could be an 8 or 9 out of 10 with a tummy tuck with muscle work or under the muscle breast augmentation. Brow lifts are typically described as a level 1 or 2 out of 10 pain, so very tolerable. Typically anti-inflammatory medications, all that is required. Occasionally there will be a drain left under more extensive elevation of the brow, but typically tail of the brow lifts do not require a drain, and they wear a wrap for a couple of days. That's removed. Patient sutures, if they do an upper lid blepharoplasty, come out on day 6 or 7. The little sutures, the tiny ones inside the hairline, are removed within that 1 week period, and most patients are back to work on the 8th to the 10th day. What kind of results can a patient expect from a brow lift? Well, typically the results are customized to the needs of the patient. Is it a full brow elevation? Is the middle part of the brow? Is it the tail of the brow? Is it the middle and the tail? So we customize the anatomic locations are going to be elevated. We customize the limited incision approach to the access. We customize how many millimeters the tail of the brow actually needs to be elevated. But patients can expect a customized, individualized approach to their elevation. The brow elevation needs to be pleasing but not overdone. You don't want to look like a scared, startled deer in a headlight, so a subtle to modest elevation. Anywhere between 3 and 6 millimeters of brow elevation is typical. And then we assess how much upper lid skin exists after the brow has been repositioned. And that is also customized into how much is excised, whether the fat pads are removed, the extent of the incision, and the placement of the incision. So I think patients in nowadays a modern brow lift surgery can expect a very customized, modest to pleasing elevation of the brow with customized eyelid contouring and upper lid blepharoplasty. And the whole effect should be creating a much more youthful, fresh, rested, non-tired look to the periocular, eyebrow, and eyelid anatomy. So how long will your brow lift last, and what is the cost? Typically, a brow lift will last 5 to 7 years. With constant pulling down effects of the muscles of facial depression in the brow, particularly the depressors, with ongoing gravity and age, it's very important that the brow lift patient commit in concept to the idea of doing Botox to help protect their brow lift. The Botox will soften the muscles that pull the brow down, allowing the elevators to exert their effect tonically without competition, and will make your brow lift last 8 to 10 years by simply doing simple periocular post-brow lift depressor muscle Botox treatments after your brow lift surgery. The cost of a brow lift is really relative to the amount of elevation, whether you're doing an upper lid blepharoplasty. It depends on the market and the surgeon. But typically in North America, most brow lifts are anywhere between $6,000 and $12,000. The upper lid blepharoplasty might be another between $4,000 and $8,000 extra. So combination brow lift upper lid blepharoplasty can cost anywhere from $7,000 or $8,000 to $15,000, $16,000, depending on how much elevation needs to be done, the surgeon's reputation, the market you live in, and the kind of aging change that you're presenting with. So what are common combination procedures done at the same time as a brow lift? Brow lift, upper lid blepharoplasty for sure. brow lift, upper and lower lid blepharoplasty, brow lift with a cheek lift or mid-face lift, brow lift with neck work, brow lift with lip augmentation, virtually brow lift with any facial procedure, including facial resurfacing for wrinkle reduction, can be a good combination approach. And so quite often you'll go through the areas that concern you, the upper third, brow, upper lid, the middle third, lower lid, cheek, the lower third, jawline and neck, and then decide what combination treatments, renovate the whole home or just do the top floor, makes sense to you. Are there any brow lift complications that consumers, potential patients need to think about? Well, there are, and you need to think about damage to the facial nerve, the nerve that serves the elevator muscle of the brow. Very uncommon to have that injured. I think I've had 1 or 2 temporary brow weaknesses from muscle stretching that always return, but there's the risk of injury to the facial nerve to the brow. There's a risk of over elevation, looking startled. The risk of under elevation, being too subtle. There's the risk of a scar in the brow, which is small, usually 1 or 2 centimeters in length, leading to a lack of hair growth in that area and what's called traumatic alopecia or hair loss around the scar. That may necessitate PRP, platelet-rich plasma, or even hair transplantation around that area of hair loss within the scar. There's the risk of sensory loss, even though it's limited incision. Sometimes a sensory nerve can be injured and it doesn't return to full function. You have an area of numbness or irritation or itching or even pain in the scalp. The biggest risk is subtle asymmetries, that one side doesn't look quite like the other. So discussing the relative merits of differential elevation, depending on the height of each unibrow, is a very important part of your preoperative evaluation with you and your brow lift surgeon. So thank you again for joining me on our weekly podcast series. Dr. Stephen Mulholland here in Toronto, Canada on Plastic Surgery Talk. Our podcast this week was on brow lift, a modern approach to brow lift surgery. If you found this informative, entertaining, engaging, please share, subscribe, and comment. See you next time.